In this video, I'm going to be teaching you the 4 progressions on how to get out of pain fast for your lower back, sciatica, disc herniation, or even a disc bulge. Hi, my name is Dr. Ken, and today we're going to be going over a stepwise progression of 4 exercises. So we have to go in sequence from step 1, step 2, then step 3, and we only move forward when we're out of pain. If you are currently experiencing some sort of numbness, tingling, or pain down the leg, or perhaps both legs, then make sure to focus on that part first and make sure the goal is to centralize. Centralization is going to be your goal. That is when the pain, numbness, or tingling from the legs is going up towards the spine. So for example, if it's going all the way down to your ankle, then you want it to go to your calf, then your mid-thigh, and then to your glutes, and then back to the spine. That is going to be your goal if you are experiencing any type of sciatic or numbness pain tingling going down the leg. Now in this sequence of these 4 exercises, if you have momentary back pain, it's going to be okay, but make sure that the pain comes down and you stay within the limits. Do not push, do not go into the next exercises if you are currently still in pain. The first exercise that we are going to start with in the stepwise progression is just going to be sleeping straight on your stomach, flat on the ground, or on the table, or anywhere that you can find a little bit comfortable. We're going to be going down like this, bringing our arms to the side, and we're going to rest our head on the ground as well. We're going to hold this position for anywhere from 1 minute to 5 minutes, and make sure that we can handle this position or this exercise before we move on to step 2. So again, when we do this, breathe, let the muscles go, let gravity do the work to help relieve some of that pressure off of our disc. If you are experiencing momentary pain, try to breathe through it. As long as the pain is not increasing, try your best to hang out in this position. As you breathe and time goes on and your body adapts, as long as the pain goes down, this is a safe exercise for you. Step 2, if we can do this exercise with no pain, just lying down like this, then we're going to move on to step 2 of the exercise, which is just to put our elbows right under our shoulders and slowly increase this extension in our lower back. Now when we do this, again, we're going to be breathing in through our nose and out through our mouth. Let gravity do the work. This is going to be increasing the extension in our lower back, which will help to decrease that disc pressure and that nerve tension and the muscle guarding and spasm. Now when we do this, we can actually lean to our left or lean to our right and see which position or which direction gives you more relief. The side that gives you more relief, that is the position that we are going into. So if we feel more relief leaning to the left, then we're gonna hang out here. If neither direction gives you pain relief, then stay in midline, which means just straight, and stay in this position. Again, we're gonna hold this for 1 minute to up to 5 minutes. And if your arm is getting tired, here's a quick tip. The quick tip is to actually use a thicker pillow and put it right under our chest, just like that, to hold ourselves up into extension. And that way it does not stress our elbows or shoulders. This position will just prop our chest just enough to get that extension in our lower back. And we're going to be holding this position from 1 up to 5 minutes, as much as we can handle. And as we do this, again, the lower back pain should be coming down. And remember, if you have numbness, pain, or tingling going down to the leg, we should start to experience that numbness, pain, and tingling going back towards our spine. If for whatever reason that numbness, pain, and tingling is going away further from our spine, so if it's going more down our legs, then you have to immediately stop this exercise. Remember, the goal is going to be centralization. The third exercise as we progress into this is going to be called the prone press-ups. Now, we were just on our elbows, but we're going to be increasing that lower back extension safely. Now, we're gonna put our hands right under our chest, almost like a push-up position. We're gonna keep our hips on the table and lock out our elbows. Now, as you can see, that's gonna over-accentuate this lower back extension, and that's the entire point of this exercise. We're gonna hold this for 5 to 10 seconds, come back down, and repeat. We're gonna repeat this anywhere from 10 to 20 times. Now, ideally, you want to do as many as you can. You're gonna hold and down. Extend out, breathe, let gravity do the work, and then come back down. Now, again, we talked about directional preference. So if you feel less pain when we lean to the left, then I want you to kind of angle our body to the left and then push up, because that's going to be even better to get 1, the centralization, and 2, decrease in lower back pain. Again, you're gonna hold this 5 to 10 seconds and do anywhere from 10 to 20 times. If neither position of the left or right directional preference gives you more relief, then stay in midline. So hold 5 to 10 seconds, and then you're gonna repeat this anywhere from 10 to 20 times of going up and down. That's the third exercise to get you back into what you wanna be doing. Now, the fourth exercise and the final exercise is going to be back upright in this position, because now gravity is going against the disc. Now, in this position, we're just simply going to be going into a lumbar extension. So we're going to use our thumbs, place them right at the base of our lower back, and we're going to be going into lumbar extension just like that, and holding, and then coming back to neutral. So we're going to hold this for 5 to 10 seconds and then repeat 10 to 20 times. This is a standing lumbar extension with a little bit of a push from our thumbs. Now, we want to start at the base, but eventually work one segment up. And once we finish that, we're going to work our way up. And we want to be using our thumbs to gently push right next to our spine. So if our spine runs along right here, we're going to be pushing right next to it. And we're going to be going here, going into extension, hold for 5 to 10 seconds, and then extend. If you want to go into a deeper stretch, we can extend our neck up to accentuate the lumbar extension. So again, you're going to do this 5 to 10 second holds and a total of 10 to 20 reps. And these are the 4 progressions of the step-by-step McKenzie protocol, how to get out of back pain. Now, like we talked about, if you have any experience of reverse centralization, so the pain, numbness, and tingling actually goes further away from our spine at any point, you need to stop. These exercises are not for you. However, if you are experiencing any type of centralization, which is that numbness, pain, and tingling going up towards your spine, maybe to your hips, to your glutes, and eventually to our lower back, then that is a wonderful sign, and the fact that these exercises are actually helping you currently. So here are some frequency recommendations. If you are currently experiencing any type of lower back pain that is almost debilitating, try to do these exercises as often as possible, whether it's step 1 or step 4. Wherever you are at in the program, try to do them every hour, every other hour, as long as you have the space and capability to do it. As you start to feel better, as you feel the centralization, and eventually just lower back pain where you can still move, but it kind of still bothers you, try to do them 3 to 4 times a day. So that's going to be every 3 to 4 hours. If you are not experiencing debilitating pain, but some discomfort and nagginess in the lower back, or maybe a little bit of that tingling going down to that glute and hamstring, then you might want to try starting from every 3 to 4 hours. And then as you start to get better, you can reduce the frequency to maybe once in the morning and once at night. Now, as a maintenance recommendation, if you don't necessarily have back pain, this extension program is actually really good for you to do at least once a day, whether that's the prone press-ups or the standing upright extension, which is the 4th exercise. The reason is because most of us are sitting and most of us have this spinal flexion that tends to cause these disc bulge or disc herniations. And so just by getting yourself into extension, you're already decompressing your spine once throughout the day. So a lot of my patients ask, why does this simple exercise help me get out of pain? Well, let me explain using this spine model. So these sponge right here in between the bones represent the disc. As you can see, most people tend to flex forward, which will increase the disc pressure and cause the disc bulge or herniation going back. Now, when we slowly extend ourselves, you can see that the sponge start to relieve a lot of the pressure. That's why the slow progression of the extension helps to get rid of your pain. Now, this 4-step program is part of the McKenzie extension protocol that helps with disc displacement within your discs. So as we slowly get you back into the extension, the muscles will relax, the nerve pain decreases, the discs are actually now decompressed and in a better position for you. And that's how you get out of pain, so you can go back to what you want to do. Thanks for watching our video. If you found this video valuable, please like and subscribe and follow us for more content. See you in the next video. Aloha.